Hi everyone, we are the Doctors Bjorkman, a physician couple who after years of giving medical advice are finally living it out for ourselves as we experience pregnancy for the first time.
And this week we're going to be diving into what we want you guys to know about the first few days of baby's life in the hospital. Kind of going through all of those special details and things that the pediatrician is going to be thinking about when caring for a brand new baby, and all the special little screening things that they do to make sure that baby is safe and healthy.
But in case this is your first time meeting us, I'm Sarah and I'm an OB/GYN.
I'm Kurt and I'm a pediatrician.
And we are the Doctors Bjorkman.
Welcome back everyone. As we mentioned in the intro, we're both doctors who've been caring for pregnant mamas, new mamas, and babies for years. And we're finally starting to put that medical practice into real life experience as we're going through pregnancy ourselves for the very first time.
And so now that I am into the third trimester, I definitely have a new and different appreciation for all things pregnancy, and am starting to ask these things like, what do I really need to have in my hospital bag? You know, what happens in the hospital for the baby right after she's born?
Yeah. And so with that, this week we're going to dive into one of those questions as we cover all of the details about baby's first 24 to 48 hours in the hospital. Kind of what things does the pediatrician think about, what do they do, what special screenings are in place to make sure that baby has a healthy start to life and that they catch any potential kind of life-changing medical issues that would need extra care during that first couple of days of life. And please be sure to stick around to the end of this video where we talk about some issues in this preventative medical care that there's been some discussion and controversy about out there in the Google sphere, about things like hepatitis B vaccines for newborn babies, vitamin K shots, and antibiotic eye ointment for new babies. And we're going to be sharing kind of some of the evidence about those things, and also our own thoughts and decisions for our baby that hopefully will be joining us in the upcoming months.
Having delivered hundreds and hundreds of babies, those first moments are so incredibly special, but they are also a really important time to make sure that that transition from womb to the world goes smoothly.
Yeah, and so there's a special scoring system that's been developed called an Apgar score that helps OB providers and pediatricians quickly make an assessment of how well baby is doing with that initial transition.
And so as the OB and kind of the first one seeing your baby, that moment I'm seeing your baby, I am assessing things instantly like tone, color, respiratory effort, vigor, to decide if it's okay to continue passing that baby right up onto mom's chest for immediate skin-to-skin bonding, or if that little one needs some extra help and should be passed off to the pediatricians who are waiting to go for some extra help over there on the warmer.
Yeah, and we often get asked, like, how many times has Sarah delivered a baby that then I've got to care for right away in the delivery room? Yes. Unfortunately, as we both kind of subspecialized a little bit, we moved away from that, but there have been instances where I've been able to care for that baby right away that needed a little extra help in the instance, and that is something that the pediatrics team is prepared for.
Yes.
So in case you're wondering what goes into this Apgar score, there are points given from 0 to 2 points for 5 different categories, adding up to a total max score of 10. And these categories are: what is baby's appearance by what is their color? What is baby's pulse or heart rate? The G is for grimace, which is what is baby's kind of reactivity to interventions and stimulus from the medical team. A is for activity, which is what is baby's tone and movement like. And then R is for respiratory effort, gauging how much work the baby is doing to breathe. These scores are taken classically at 1 minute of life, after 5 minutes, and then sometimes after 10 if those first few scores are low. And then judging on these, anything 7 or above is within normal. If the number is less than 7, that's a good cue to the medical team that maybe baby needs a little extra help, maybe baby should go to the warmer for things like a good rub down and some drying and stimulation. Maybe they need a little extra help with their respiratory effort as they're making that transition from the womb to the world and getting those new baby lungs opened up and ready to function on their own. No matter what, everything that the pediatrics team should need to provide these basic support cares for baby in those first few minutes of life should be in the delivery room for them, and they are all well equipped and know exactly what to do in those moments should baby need any extra little bits of help.
One question I get from moms about the delivery and baby is about something called delayed cord clamping.
Yeah, and so what delayed cord clamping is it means that instead of immediately clamping the umbilical cord to separate mom from baby, an additional 30 to 60 seconds is given to allow extra blood to flow from the placenta into baby.
And so this may seem like a small thing, but it was actually a pretty big change for many practices in 2017 when the American College of Obstetrics and Gynecology started to recommend this practice, and that was backed by the American Academy of Pediatrics. So since that time, a lot of study has been done about how that is impacting babies and their outcomes, and so far the results have been very positive.
Yeah, that's totally correct. In fact, just in December of 2020, the American College of Obstetrics and Gynecology updated their statement to share some of the results of what they've been finding has been happening with babies who have been undergoing this simple process of just delaying the cord clamping by 30 to 60 seconds. And some pretty positive results that have come from this. So number one, and kind of the most obvious, is that babies who have undergone this have increased hemoglobin levels, which is kind of a measure of their total blood volume, and increased iron stores for the first several months of life, which may help improve development. Additionally, they've got things like improved red blood cell volume and decreased incidence of some pretty significant things like necrotizing enterocolitis, which is kind of decreased perfusion of the gut that can lead to some pretty significant issues for baby, and decreased incidence of something called intraventricular hemorrhage or brain bleeds. One kind of side effect that's kind of on the other side of is this good, is this bad, is that there is a very small increase of babies who've needed phototherapy for jaundice or elevated bilirubin levels. But from my understanding of the data, there's been no significant increased risk of complications from this jaundice.
And importantly, there is no increased risk of a postpartum hemorrhage or heavy bleeding after delivery for moms.
Yeah, so overall, a great thing to do.
For term and preterm babies.
Yeah, and to help them making their transition from womb to the world.
Yep. So before we get into the more medical stuff and screening type things for the baby's care in those first 2 days in the hospital, will you talk a little bit about some of the normal baby things that the peds team is going to be looking out for?
Yeah, absolutely. So, of course, a big part of the role of the pediatrics team is to make sure that baby can do and is doing all of the things that baby needs to do for normal life. So in addition to that initial assessment of heart rate and respiratory effort and tone, over the first few days, day or two of baby's life, we're going to be making sure that baby is feeding well, that they've had at least one pee in the first 24 hours, that they've had at least one poop in the first 24 hours. And also making sure that bonding is going well between baby and family.
It is really important to know that you absolutely cannot spoil your newborn baby with too much love or affection or holding. Those first couple days are an awesome time to be skin to skin.
Yep, for moms and dads.
Yep, and it's just a wonderful time to bond with your baby and to work on feeding. So one really important thing to mention here is to use that time you are in the hospital to kind of learn how to keep your little nugget alive and healthy when you get home.
Yeah, so I cannot stress this enough. Like, having spent lots of time in newborn nurseries, like, the nurses are going to be your best resource in learning things like, gosh, how do I care for this new baby? What about like breastfeeding? And like use their help while it's available and just practice doing newborn cares thing and ask how they think you did about it.
Yeah. And on that note, if you are having issues with breastfeeding, or even if you're not, it's a great time to ask to see the lactation consultant because you can use these resources while they're readily available right there with you in the hospital. Those first couple days are so important for establishing a good milk supply and working on baby's latch and all these other tricky things that come with learning to breastfeed. So it's a great idea to just see the professionals while you're there.
Yeah. And it's also a great time for dads and moms too to work on practicing your swaddle technique for wrapping baby up, or even getting the perfect seal on a diaper to hopefully limit some of those diaper blowouts that are for sure in your future.
Yes.
As baby is getting the hang of all these normal parts of baby life, the pediatrics team is going to be looking really closely for any other special health issues that might need extra attention. And the way in which they do this is through a really good, thorough physical exam and a couple of special screening tests.
So what makes this physical exam so special?
Yeah, so as a pediatrician, when I examine a newborn baby for the first time in the hospital, I have a list of about 45 things I want to look at every time as a part of my head-to-toe assessment to make sure that I don't miss anything.
Okay.
And so this includes things like looking in the eyes, looking in the ears, listening to the hearts and lungs, feeling all the pulses, checking to see how their hips move, and many other things. And it's really amazing that by looking at how baby's weight is trending, the vitals, and this good, thorough physical exam, the pediatrics team can pick up on a lot of issues that might need special care or attention.
Awesome. So in addition to that thorough physical exam that's done every day, the pediatrics team also does a couple other simple screening tests to pick up on things that might not be so obvious but could be very dangerous for your little one. The first of those things is screening for congenital heart disease, and the other one is the newborn screen, which is screening for certain conditions that could be potentially dangerous for your baby.
Yeah, and so the screening test for cyanotic congenital heart disease is very simple, but also has been incredibly effective at picking up certain heart conditions that would require care from the pediatric cardiology team, and then also likely need surgical repair in the baby's life. And so with that test is as simple as putting a pulse oximetry probe on the right hand and then on one of the feet, measuring the saturation of oxygen in those points, and then also the difference between the two. Of note, it's really important that this test is recommended to be done between 24 hours and 48 hours of life.
So you can kind of expect to stay at least past that 24-hour mark postpartum because they want to do these screening tests at the right time. The other important screening that is done is also done after the baby is 24 hours old, and that is called the newborn screen. So for the newborn screen, it's a simple blood test. They poke the baby's heel and get this little drop of blood that is then sent off and can be tested for over 50 different health conditions that could have major impacts on your baby's health and development. And the thing with the conditions they're testing for is that they are things that are not picked up by that newborn physical exam alone, and you don't want to miss them.
Yep. And so the results for this newborn screen usually take a few weeks to come back, and so this is something that your pediatrician will be sure to follow up at that 1 or 2 month visit. With that, depending on the state you're in, what they're testing for may vary a little bit. There's a classic core 35 different diagnoses that are tested for kind of nationwide in the US, but depending on what state you're in, this could be almost up to 60 different conditions. If you're interested in what diseases your state tests for specifically, you can check out this link below for babiesfirsttest.org. So in addition to making sure that baby can do all of the normal things and doing the preventative screening, there's also some really important medical cares that happen in the first day of life to prevent significant disease and disability in babies. And so I want to preface this next section by saying that if you were to Google things like hepatitis B vaccine for newborns, vitamin K shots for newborns, or erythromycin eye ointment for newborns, you're going to find that a lot of people have a lot of different opinions about these things. And so one of the things that we want to say with all of this, and we're going to share kind of what our thoughts are to them too personally for our baby, but there have been lots of studies in looking at these to show that they do dramatically decrease risk for baby from some pretty significant disease.
So I feel like you mentioned a lot of different things quickly, so can we break down each of those different preventative care measures?
Absolutely. So the first of these that we're going to talk about is the hepatitis B vaccine. And it's likely that the hepatitis B vaccine will be the first vaccine that a baby gets, and likely the only vaccine a normal newborn will get until they have their 2-month well check with a pediatrician. And so we know there are lots of thoughts about vaccines, and we're not going to be able to get into all of that today, but we do want to say that this vaccine has been studied extensively, shown to be safe for baby, and has had dramatic effect on reducing the risk of hepatitis in newborns. So, depending on where you live, the risk of hepatitis B could be pretty low. But even despite that, the consequences of getting hepatitis B in the newborn period can be very severe. So, as it turns out, if a baby gets hepatitis B before they turn 1 year of age, the chance that they will develop chronic hepatitis is 90%. And then in addition to the pretty severe consequences of this disease, 25%, if left untreated, will die from liver cirrhosis or liver cancer.
And so it's because of the risks of this severe disease that it is recommended that all babies in the United States receive the hepatitis B vaccine within the first 24 hours of life.
And the great thing about this is since initiating this policy in the early 1980s, the rates of hepatitis B have dropped by 90%.
That's awesome.
Now, vitamin K supplementation has been something there's actually been some discussion about recently, and there's some variation of recommendations based on what country you live in. But again, this is a very low-risk preventative step that can prevent some very severe disease in a newborn.
Vitamin K is something that helps the clotting factors in your blood stop bleeding. The human body doesn't make vitamin K, so we are dependent on getting vitamin K from other sources like green leafy vegetables, broccoli, or Brussels sprouts. Babies also are born with very low levels of vitamin K, and unfortunately there's only low levels of vitamin K in the breast milk.
Now, there's something called vitamin K deficiency bleeding, which is a severe bleed, usually in the gut or in the brain, that often requires emergent surgery and can have significant consequences like death or severe delays in development. It's important to note that the highest risk of this bleeding is in babies who are exclusively breastfed because, as we said, breast milk is really low in vitamin K. There's actually almost no reports of this bleeding in babies who are formula fed because there's lots of vitamin K in formula.
Got it. So there is some evidence that an oral supplementation regimen may help limit the risk for the severe bleeding. However, the data shows us that it's just not as good as just getting the vitamin K shot, and so that is what is recommended in the United States.
Yep, and that oral supplementation there is talking about giving it directly to baby via the oral route rather than giving an intramuscular injection.
Got it.
There's also some studies that look at what if we supplement mom and give mom lots of extra vitamin K, and that has been shown to raise the levels of vitamin K in the breast milk a little bit. But that effect hasn't been shown yet to help reduce the risk of these significant severe vitamin K deficient bleeds.
Got it.
Now, if you live in the UK or in Canada, there are oral vitamin K supplementation regimens available for newborn infants. Some important things to know about this, however, is that if you choose the oral supplementation route, they need to be redosed multiple times to prevent late vitamin K deficiency bleeding. Also, these regimens, while they do help, have not been shown to be as effective as getting a vitamin K injection at reducing the risk for vitamin K deficiency bleeding.
Got it.
So with that, some quick kind of facts that you should know about vitamin K supplementation is that there is no oral version of vitamin K available for babies in the US that's been proven to reduce the risks of vitamin K deficiency bleeding as good as the shot.
The shot is actually more easily absorbed by baby than the oral version.
Yeah. Also, getting a vitamin K injection has delayed release that helps reduce the risk of late vitamin K deficiency bleeding.
And so when you get that shot, the chance of getting that late onset vitamin K deficiency bleeding is essentially zero. So for us, the decision about the vitamin K shot and the hepatitis B vaccine is pretty easy and straightforward.
So you've got the opportunity to do something that we know is very, very low risk for babies, something that's been given to millions of babies and can prevent some pretty significant disease.
Right.
You know, for hepatitis B, it's preventing what could be chronic liver disease and potentially liver cirrhosis, liver cancer that could lead to death. Also, like with the vitamin K supplementation, this is something that it is a shot of a vitamin that we use in the hospital as a medication often that can prevent some significant brain bleeds or gut bleeds that, even though the risk for baby is very low, should those happen, they can be potentially devastating or cause death.
Right. So am I excited about my little sweet newborn baby getting 2 pokes in those first 24 hours? No, of course not. But really, really low risk, minimal pain thing for preventing possible terrible long-term consequences is worth it for us.
Yep. And we're going to talk about erythromycin eye ointment next. And this is a place where our risks are significantly different. And so we're going to have a conversation with our pediatrician about what do they think. And I think there's a good chance that maybe we don't use the eye ointment, but that's going to be with the guidance of our baby's pediatrician.
Right. And if they have like super strong feelings that, hey, we really think you should put this little bit of eye ointment on the kiddo's eyes, fine. It's a low risk thing, and great. We will seek the counsel of the people who are taking care of us and make the best decision for our family, as should you. Another preventative measure during that baby's first day of life is potentially putting antibiotic ointment, often erythromycin, on the baby's eyes to prevent an infection that can potentially lead to vision issues or blindness. And so this is an infection that mom can have, and baby can catch that infection on the way out in the birth canal, or even can get passed from mom to baby at the time of a C-section.
And so historically, 1 in 10 babies would get an eye infection or neonatal conjunctivitis, sometimes called ophthalmia neonatorum, shortly after birth. And of these babies who got this ophthalmia neonatorum, 3% would end up blind. Since that time, however, we've gotten way better at preventing this disease by doing 2 things. So one, we're way better at screening moms for signs of these infections that could potentially pass for baby and then treating them appropriately.
Yep.
And then number 2 is we started putting antibiotic eye ointment on the eyes of all babies after birth.
As Kurt mentioned, our medical system has gotten a lot better at preventing neonatal conjunctivitis, and a lot of that has to do with doing a better job of screening and treating pregnant moms that have this infection. And that is part of your routine OB prenatal care. You're screened for the first time in the first trimester with your first trimester labs, and then sometimes it's repeated again in the 3rd trimester with your 3rd trimester labs.
And so as we've gotten better at preventing even this infection from being available to pass to baby, the recommendations on treating all babies are starting to change. So it's important to know that as recent as 2019, the United States Preventative Services Task Force and the American Academy of Family Physicians continue to recommend putting antibiotic ointment on the eyes of all babies right after birth to prevent neonatal conjunctivitis and the potential consequence of blindness. However, the year before, in 2018, the American Academy of Pediatrics came out with a recommendation that maybe we could do more targeted treatment of babies that are at highest risk for getting neonatal conjunctivitis, and then counseling all other families about what to look for in terms of signs of neonatal conjunctivitis, with then having a quick treatment thereafter. So with that too, the Canadian Pediatric Society no longer recommends treatment of all babies with antibiotic eye ointment after birth.
So with that, talk to your provider about what your risk factors are, what your risk factors for baby might be. It is a very low risk treatment to just put some ointment on the baby's eyes, where an infection in the baby can have very devastating consequences of potential blindness. So have that discussion with them. It may be something you need, or it may not be something you need based on your risk factors.
So before this episode gets any longer, we're just going to wrap things up by saying there are other kind of important parts of newborn care during those first couple days in the hospital, and then in the first couple days after going home, that we haven't had a chance to cover here.
So if you are like me and feel like you're not exactly sure what you're supposed to be doing when you take that newborn baby home, you can check out our episode that we will link here that is all about basic newborn care, caring for a baby boy's new circumcision, car seats, all those kinds of things. It's a great episode. Be sure to check it out.
Yeah, and be sure you're subscribed to our channel too. As we're getting ready to meet our own baby in the upcoming weeks, we're going to be coming out with a lot of great information as we get ready for that, both labor and caring for a newborn baby.
Yeah, thanks for being here.
Bye, guys.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider. You need to hand the baby off when it's like...
I mean, I let the nurse stim him usually for 10 seconds.
Huh? It was just like the OB resident was just holding this baby, like showing it to the family. Do you want to hold the baby? And I'm like, we'll take them.
I pretty much 10 out of 10 throw the baby up on mom and make the assessment right there.